Good evening, everyone. My name is Morgan Ray. I will be your host this evening. I am the director for Synergy Face and Body, located in the Carolinas in Raleigh, North Carolina. We are very excited to have everybody together this evening as we've had an outstanding response and we have over 600 people joining us tonight in this virtual arena. First and foremost, we want to thank everyone for joining. We know it's your evening, but I promise you it's going to be worth the experience. We will have the opportunity to hear from 4 physicians and live Q&A, before and afters, even the opportunity to hear from patients that have actually gone through the procedure, so you can see not only their before and afters, but also getting to reach out and ask any live Q&As that you might want answered. I'd like to take the opportunity shortly to introduce you to the 4 physicians that we will have the opportunity to hear from tonight. They're going to be going over everything from procedure, the consultation, the actual procedure itself, what that's going to yield downtime. Are you comfortable? What you can anticipate in regards to your outcomes. Also demonstrating more of what the procedure actually entails, which can be kind of an unnerving part, but they're going to do a great job to demonstrate that for you. First and foremost, we have the creator of the actual device, if you will, and technique. We have Dr. Gregory Mueller. Then we have Dr. Duncan Hughes is going to be joining us. He is my physician I'm lucky enough to work with day to day in Raleigh, North Carolina. We have Dr. Jason Pozner out of Sanctuary, and that's down in Boca. And then we have Dr. DiBernardo, who is last but certainly not least. We're very fortunate because each of the physicians will be speaking to a little bit different version of the procedure and how, based on the assessment, it can really be customized and tailored to your outcomes. So not only just addressing the jawline and lower face, but now we can add lids, we can add tightening, we can do kind of all the things. So to say that this sounds too good to be true, it's definitely something that has evolved, and it's taken many, many moons and many years, although Dr. Mueller does not look that way, to get everything to where it is now. We're so thankful he's sharing all of his tips and tricks in the evolution, so we all have other options that we didn't once have before. As you can see, he's got a pretty extensive background. Looks like he might have been doing this for a while. Maybe he's got it figured out. I'm sure he's not one to boast or brag, but you can see by just some of the bullet points here, very well established and very accomplished. That being said, he's going to be the first one to kick off everything tonight. That is a picture of his practice in Beverly Hills. The fact that his tag is at the neck doctor makes me think that he really knows what he's doing. And so he's going to be the one to really get us started this evening. Everybody will have the chance to reach out and to ask specific questions of all the panelists. So just sit back, relax, listen, and we are so happy to have everyone here tonight.
Morgan, thank you so much. And thank you everybody for tuning in this afternoon. We hope that we can give you a really good perspective about what MyEllevate is. And then Dr. DiBernardo is going to talk about some other exciting technologies that are also being offered as well. If you look at these pictures, you'll get an idea of why I came up with this idea of an ability to address the underlying bands and glands of the neck without opening it. See these pictures before and after, and you see the after pictures, the bands are almost worse. And then look at this one here. You can see that the platysma banding, that's what we're going to talk about tonight, is our solution for that does not require invasive surgery. You can see here that her band is worse as well afterwards. So, procedures that are currently available today include things such as liposuction, energy-based skin tightening that we're going to talk about tonight, such as Precision TX. And then also we're going to talk about facelifts. This is not a facelift. This is not a neck lift. This is something that's less invasive, yet very effective and long lasting. So you can see in this patient, she looks better in the after picture, but you can see the banding is more apparent. So what is the answer? You know, we talk about facelifts and neck lifts, and a lot of today's patients are just afraid of this big surgery. It's more invasive, more downtime, things like that. What MyEllevate offers is a solution that is less invasive with a shorter downtime, but also very long-lasting results. And we're talking years, 5+ years. So the neck is really important. You know, this came out in the Wall Street Journal during our lovely COVID period that hopefully we are all emerging from. They talked about the neck. Everybody sees their necks, just like all of us today on this Zoom conference. We're more aware of our necks than ever, and I'm sure that's why a lot of you are here. This science and this technology is not new. Just like Morgan was saying earlier, I've been working on this for over a decade. I published the first results back in 2012 of the actual science of using light-guided suture delivery and the safety of that, and also the effectiveness of it. The MyEllevate procedure is the result of an evolution of this technique over a decade. So what you're seeing today is not brand new. This is something that has been tried and true, and all of the surgeons today are very well trained in the technology and the technique. So here's what it is. Basically, what we're doing is we're passing a suture thread underneath the skin through little needle punctures in the skin to sew and shape the undersurface of the jawline. And this is what we call the Hollywood jawline. And the way the technology works is we use light guidance to create sort of a corset underneath the skin that is permanent, that sits right on the muscle and lifts and supports and shapes everywhere. So what it does, it helps define the jawline right in front of your ear, as well as underneath the chin and all the way to the other side. Totally invisible. Everything is done through little punctures, and there are no sutures with this technique. So it's pretty amazing. We may use a laser to tighten the skin during the same treatment. We may use some liposuction to remove some fat. The other surgeons are going to talk about that more in detail as we move on today. But this is the technique here. And basically at the end of the procedure, as you can see here, we just tie the two ends of the suture together, and bravo, you have this support underneath the jawline. So these are the treatment areas that we look at. We look at skin elasticity, we look at fat content, and we look at muscle and gland position. And sometimes people come in and they just have a little bit of fat underneath there. And with those patients, we just do a little bit of liposuction. So we would not need to do the MyEllevate procedure. So these are those muscle bands. That's why we're all here today. This is a non-surgical solution for those irritating bands that come down the front of the neck that make us look older. So the patient selection, these are the ideal patients. So it's really for everyone. If you're a young patient on today and you've got sort of that ski slope neck, MyEllevate's a great solution. If you're in your middle ages and you're starting to show some early signs of aging, MyEllevate combined with energy is a great alternative. And then if you're older, today Dr. Pozner is going to talk about the MyEllevate Plus procedure that he and Dr. DiBernardo have been pioneering. That's a little mini tuck where we remove just a little bit of skin behind the ears and also use MyEllevate. These are examples. This is the OVO 360 imaging system. All of the surgeons on today have this system in their offices, but this is how I really developed the procedure and the technology. Look at this patient before and after. He just had the MyEllevate procedure. Look at his jawline, look at the beautiful sculpting, look at the shadowing. Here's another patient. This patient is a type 2 patient who had energy to tighten the skin. This is face tight, which is a radio frequency energy. Look at his images 14 months after the procedure. And here's a lovely patient, 50 years old. She did not want to have a facelift or neck lift. This is her just 4 months after the MyEllevate procedure and face tight. Look how beautiful her jawline structures are. No incisions, no scars, no signs of surgery whatsoever. And I just want you to see this last revolution of the OVO, and you'll see her looking downward and notice the beautiful contours. Look at those folds in her before image and look at her after. And this is the type 3. I just finished one of these today. So I did a woman today who's 75 years old. We did a little skin tuck behind the ears in the form of a neck lift. And then we used MyEllevate to address the muscles and glands underneath the neck. This patient is 3.5 years post-op.
Thank you so much. Amazing the outcomes, but also seems everybody's hair looks better afterwards too. I noticed. I don't know if that has something to do with anything you're offering.
It's because they're happier.
They're happier. Yes, yes, much happier.
We have Dr. Duncan Hughes. He's going to be speaking about basically just the MyEllevate standalone. As Dr. Mueller mentioned, you have many different components that you can couple together in regards to different modalities for tightening or actually removing small portions of skin. Dr. Hughes is going to speak to us about all that can be done literally just with the MyEllevate suture under a local anesthetic. And Dr. Hughes, take it over, please.
All right. Well, thank you. Thank you, Morgan. Thank you, Greg. And, you know, everyone on this webinar, you're here for a reason. This is a game changer. And what we didn't have before this, we either had Botox for the neck or a facelift or a neck lift, and we had nothing in between. And this procedure, which we're going to go over in this slide, will show you it's sort of soup to nuts of the four main things that we covered. Dr. Mueller talked about those bands, those pesky bands. We can divide those bands. And then sort of in the middle section there, number 2 and number 3, we can get rid of some of that fat. And then we usually add a little bit of energy to get some skin tightening, but then to top it off, not just the cherry on the top, but the icing on the top is Elevate. And that's what's been missing, because as Dr. Mueller's first slide showed, we do a good neck lift, we do the good minimally invasive stuff, but that band is still pesky. Those glands are still pesky, and that's where Elevate comes into play. So that's where this really is a game changer. So the question is, who's a candidate? Now, when I first learned about Elevate, I wasn't really sure who was a candidate, and I thought it was really a small selection of people. But the reality is, what I've learned is almost everybody is a candidate. And that's what's amazing about it. Now, again, we're talking about sort of those 4 things. Not everyone needs all of it, but everyone is pretty much a candidate. So this is a slide, Dr. Mueller showed the slide of what's going on the outside. On the inside, this is what's happening. That suture is tethering those bands, and it's suspending everything up underneath. So it's suspending that muscle, it's suspending those glands that are causing that pesky bulging here. And that's what that's doing on the inside. And again, the beauty of this is it's all minimally invasive, no stitches, no suturing, little tiny insertion points. So these are some results, and this is real. This is what we're seeing 2 days after the surgery. So this is a person who had the MyEllevate and some, again, the little bit of liposuction, also had a little bit of energy, but this is 2 days after the surgery. Minimal bruising, beautiful neckline. Different patient, this is 2 weeks post-operative. And notice what I love about this is no scars. The thing that I really talk to my patients about with a facelift or a neck lift, the scars are a big deal, right? They're real. Now, if a patient needs that surgery, so be it. But I love this neckline. I love the contour of it, and there's no scars. So this is a 56-year-old woman who had the skin tightening and the Elevate. And you can see preoperatively, she has those bands, she's got that extra skin. And these are lean women and lean men. Actually, by the way, this is for men too. But you can see 1 week out, there's some nice tightening. 3 weeks out, that's miraculous. I mean, that's just, it's a game changer, again, without the scars. This is, as Dr. Mueller was saying, like a type 3 type patient where there's a little more fat, so we need a little more liposuction. There's more of those glands that we have underneath here. And, you know, to go from the pre-op to the post-op photograph in the course of an hour, as Dr. DiBernardo was saying, you know, under local anesthesia, it's pretty cool. Yet again, so this woman, you might look at her neck on the left, and she's only 1 week out, and that pesky skin, all of it's there. We know what it looks like. And other than a neck lift, and to Dr. Mueller's point, even a traditional neck lift sometimes didn't really address that central component. You know, that's a real difficult place to address. Out here, that's much easier. Right here, a little more difficult. And that's where Elevate comes in, because it really addresses that central part and tucks that up. So this is a woman who also had eye surgery. That's why she's having some bruising there. And Dr. DiBernardo will talk about that. But look at that jawline. One of the things I really like about the results that I'm seeing and that I've seen from my colleagues here is that it doesn't look like you had a facelift or a neck lift. You know, that traditional, Dr. Mueller, no offense, that 1984 Beverly Hills facelift where everyone looks very pulled. Like, we don't see that anymore. People don't want that anymore. It's more about, I want to go to my friend's house, I want to go to the club, I want to go out to dinner, and I don't want people to think I've had plastic surgery done. And prior to this type of technology, that's all we had was the traditional surgery, which looked great in the long run, but in the short run looked a little pulled. It looked a little exaggerated. So that's where this is great. And in 2022, this is perfect for the environment, where you can have these results a week, 2 weeks, 2 days after the surgery, and just be great. Again, look at that. I mean, that's 2 days after. She's got a little bit of bruising, a little bit of swelling. That's from the liposuction component likely, and that energy that we were talking about to tighten that skin. The eyes, again, Dr. DiBernardo will talk about that, but if you just look at that neck, look at that jawline. It's amazing. Yeah, and one could argue you can't get results like this with a traditional surgery without all of the downtime and the additional incisions under the chin. The minimally invasive part with these results is fantastic. Again, this is 4 days after, a little bit of bruising, a little bit of swelling. You know, and as far as the recovery goes, people describe it as being sore and a little numb. People always say to me, as they say, it's weird because I feel numb, but I feel sore, but it's not that big a deal. And we have you wrapped up, and compression is a big component, and all of us surgeons will go over that with you. But as far as, you know, is it a painful recovery? No, it's not at all. All right, so now we're going to go back to Morgan, and I think we're going to talk about some real patients, some real testimonials.
Yes, thank you so much, Dr. Hughes. Those before and afters were outstanding, just amazing, amazing. Yes, this is Cindy. Cindy is an actual patient, and Cindy is going to share a bit of her experience, basically what took her in to even consider this in the first place, then her experience, and then sharing her outcome and questions many of you have and have sent in already, wanting to know more about the actual process. So over to you, Cindy.
Well, hi, everybody. I just have to tell Doctor, I'm so happy I did this. He knows I was very nervous about doing anything invasive, and I was unsure and unhappy. I mean, when I look at this now, I get scared. Did I really have that? I don't want to think about it. But I had a very good motivating factor to do this. My stepdaughter was getting married, and I didn't want to have that look. You know, you're going to have really wonderful pictures. And I was I just was worried about having those to look at for the rest of our lives. So I decided to go ahead and do it. As you can see, the date, it was in February, and she was married on April 2nd. And I was picture perfect then, and had just a lot of really good feedback. And it was definitely not a procedure that was painful. Like doctor had said, it can be numb, but other than that, no scars, little pain. The pain really you didn't feel because it was numb, so you really didn't feel any pain. And as you can see, it's lasted an amazing amount of time, and I'm so very happy I did it.
Cindy, I would love to just say something really quick for the audience. Sure. If you look at the dates on the OVO images, if you all notice, this is 5 years and 9 months after her procedure. We used Precision TX, that's a laser to tighten her skin. We used a little bit of fat removal with liposuction in MyEllevate. And Cindy looks amazing. So she had no incisions at all. And this is almost 6 years after. And actually today, you are over 6 years after.
Yes, I am. So you're right.
She looks amazing. And Cindy, is there anything you'd tell anybody about it before we sign off?
Well, what I'd like to say is that, like you've discussed, there are different patients that this could work for, but it is something that can be a man or a woman, and you could be any age. And I think it's something that people can consider, because again, if you don't want those invasive procedures, this is definitely one that is worth looking into. And I'm happy to see that there are so many people who are joining the webinar in order to learn more about it. And I think that it's definitely worth considering. I hope that this information is helpful for other people to make that gift to themselves. Basically, this is a gift, and I'm so happy I did it.
Thank you, Cindy.
Thank you for coming on with us.
Of course. Have a good evening.
So Greg, this is Jason. This is a good time. One of
Yes.
the questions we got was how long this procedure lasts. So Cindy's 6 years out, but you've been doing this the longest. So how long would you say it lasts?
So I've been doing this for over a decade, doing the research and development of MyEllevate, and we have patients who are 5, 6, 7 years out. And when we have them look down, you can still see the support of the system. Now, the skin may get a little bit lax because they are going to continue aging, so they'll have a little bit of loose skin. But we can use things like Potenza or RF microneedling or other things to tighten the skin. So we tell patients 5, 6, 7 years, somewhere in that range.
Right. And it's not like Cinderella where you're going to go back to, where you started for them at the end. You continue to age after you have this done, but you don't go back to stage one.
Absolutely. It's a very slow aging process. And I think also that it slows down that aging process in the neck, because we're giving patients an invisible little corset underneath there to lift everything and shape it.
And then while we're here, before I go on, I keep getting this question all week. Do you need those do you need those bands and that muscle in the neck? Everyone always asks me that same question.
The muscle in the neck is a plate of muscle called the platysma, and it's used to kind of cover our deeper structures. You don't need those little bands in front. You don't.
So when we cut them, it's safe, and it's what we do during the facelift anyway, is cut those bands. So you don't need those bands.
That is correct.
Okay.
And I'm going to now pass this over to Dr. Pozner.
So I'm Jason Pozner from Florida, and I'm going to talk about the plus procedure. And if you look at this slide, it says, well, it's for older skin, but some of the younger patients have excess skin. And what happened with this procedure was we were really doing many MyEllevates, and we get on the calls and discuss it. And then we do some ads for patients, and patients would hear about it. And the patients that would come in were not the best candidates for MyEllevate. There was just basically, in a nutshell, there was just too much skin. And this is a great procedure, but if you have too much skin, you're either older, you lost a lot of weight, or you just have a lot of laxity from photo damage, the regular MyEllevate procedure was probably not the best procedure for you. So we all kind of put our heads together and came up with this plus procedure. And with the plus procedure, basically it's the same MyEllevate case, plus you're taking out some skin behind the ears. So it's sort of a half a facelift. It's a neck lift, and it's almost always done under local anesthesia, although we've all done them on patients who are undergoing something else under general anesthesia. But I would say 90% of the patients we did were under local anesthesia. I did one yesterday morning. It takes about an hour, 15, hour and a half to do this procedure. And again, we just give the patients a little bit of oral drugs and usually a little Pronox. And it's a very, very comfortable procedure for the patient with much less downtime than in a regular facelift procedure. And many of the patients who you might talk about that they would need a facelift, they just don't want a facelift. So this is another group of patients that's just perfect for this procedure. So let's kind of look at some patients' results. So if you look at this before patient, you know that when you take out that fat with the liposuction portion of it and place the suture suspension, she just has too much skin. And she would not have an optimal result. So with this, we're taking out some skin behind the ears and getting a better result. And if you see the patient on the right, the skin quality is just bad. So that's why as you get older and you lose your elasticity, kind of like old socks, you need to take some skin out to redrape the skin, the neck better. Okay, so if you look at this jawline, look at the patient on the left, the pre-patient, there's just too much skin. We all look at it and we'll go, if we did a regular MyEllevate, it would look up better, but it would just not look optimal. And you can see on the table, this is a local anesthesia procedure with just some skin excision behind the ear. That's the post-op on the table. And they're wrapped up for one night, and the next day we take the dressing off and put them in a lighter dressing. So it's a very quick recovery, much quicker than any of the facelifts. And you can see some of the progression of this. I mean, all of them on the table, they look much better. And you see also, you'll note there's very little swelling and there's almost minimal to no bruising. Once in a while, you get someone with a little bruising, but for the most part, I've been amazed at how quick they look good. And when you have someone like this, just basically when you take the fat out in this type of patient, there's just too much skin. So you have to really remove some behind the ears. In the past, if you asked me prior to MyEllevate, I would have said this patient needs a very extensive facelift procedure to get rid of the fat and to redrape the skin. But with MyEllevate, we really turn this patient into a quick recovery, minimally invasive procedure. And here's another one. I mean, just a little older patient. And note the jowl improvement as well. The jowl is pulled back. Sometimes we do a little liposuction of the jowl. Sometimes the incision goes up a little bit in front of the ear. But for the most part, most of the patient's incisions are well hidden in the hairlines. And you can see the 3/4 view. You can see the patient had no jawline with a big jowl. And in the post-operative photo, there's a very nice distinguished jawline and with a nice crease there, which is what we're trying to achieve. And again, look at this patient. Prior to MyEllevate, she would have gotten a facelift, no question. But many of the patients come in, they don't want the anesthesia for a facelift, they don't want the downtime for a facelift, they don't want the scars, and it's just more than they want. And all they want is a bit of neck tightening. And as you can see in this before and after, that's exactly what this patient got. And that's 2 weeks post-op. I mean, they look amazing very early on, which is, again, keeps surprising me. And you can see, good jawline, the bands are gone, significant banding. And, before when we used to take the fat out of these patients, these bands would become more evident. And with this procedure, the first thing is you cut the bands and they look amazing. The next day they look like this and there's no banding. And the bands are what's pulling some of the central neck down. And it's not just for women. We've all done a lot of men. Many of the men, they don't want that pulled look. Nobody wants to look like Kenny Rogers. They want a neck that's tight, but they don't want to look pulled. They don't want their smile done. And the men, basically, most of them don't want a huge procedure. They want to get back to work and play quickly. So and you can see in this patient, I mean, look at the banding and the neck on the right side. And in the post-operative photo, the banding's gone. He just looks like he's, 20 years younger.
And Jason, sorry to interrupt, but
no, please.
With men, we can't afford the scars, right? I mean,
Yeah.
with my hairline, Greg's doing better than most of us. Barry's doing better than all of us.
Not
but
me.
you
I'm
and
doing
me, we can't afford those scars. So, up until this point, men didn't really have much of an option.
Absolutely. And the men love this local anesthesia procedure. And you can see this is a very cut jawline. Barry, you want to say something?
This is the hardest of all, because usually if we're doing a plus in a woman or even a man, there's some hair to cover it. This guy didn't have any hair at all. So this is the most exposing of all.
Yeah, really good point. There you go. And this is a 3/4 view. I mean, you can see this guy, he'll tell you he was probably looking terrible on the phone. He wouldn't want to do FaceTime calls. He was doing Zoom calls, looked bad. Every time he looked down, he just wanted to point his head to the cloud. So, I mean, he has a young jawline now, a really Hollywood jawline. And we're going to show this video of Lewis, who's one of Dr. DiBernardo's patients. And he's going to talk about his experience with the plus procedure.
I can't believe that I just finished this operation and I'm going home and I have no pain, I have nothing, absolutely nothing. This is perfect. I couldn't ask for better.
Thank you so much, Dr. Pozner. One quick question before you hand it over. This is something we've seen come through many times. Patients are wanting to know, how long does the actual procedure take for you to perform?
So I always say that the regular MyEllevate procedure takes me between 45 minutes and an hour, and the Elevate Plus usually takes me hour 15, hour 30. So that's pretty routine with that. And also, everyone on this call has done quite a few of these, so we're pretty slick at it.
Perfect. Thank you so much. Well, last but not least, Dr. Barry DiBernardo, if you will take it over and take us through the more plus version of all the things that you're doing. And there you are.
Okay. Thank you, Morgan. Thank you, everybody so far. This is us at New Jersey Plastic Surgery in Montclair. And before I start talking about some other things, we have a patient, Catherine, that wants to talk to us. Catherine had the Elevate Plus procedure. So I think we heard from someone who had the regular MyEllevate, but let's get Catherine to talk about the Elevate Plus. Catherine, welcome. How are you doing tonight?
Oh, fine. Thank you.
And again, thank you for coming on and speaking to everybody tonight. So let's just start with what were you thinking in the beginning? What was bothering you? And how did you end up choosing to go down the MyEllevate route?
Well, my neck was sagging. I didn't like the way that it looked in the videos that I was participating in almost daily with my work. And I was very happy to learn that there was a procedure that I could have done that was not invasive, had a quick recovery time, and it had lasting results. And that was how I chose the MyEllevate.
Excellent. And that's a big choice for patients in this because, and the reason we do these webinars is people don't know this is available. So let's play the tape forward to you've had it done now. You did a plus. In a little bit, I'm going to talk about eyes also because you had both done because I think it makes the whole face look better. But what was tell all these people, what was the experience like for you to go through this? Was it as easy as we're saying, or was it worse than that?
It was so easy. I mean, I literally, by the end of 1 week, I looked like I didn't even have surgery. I had no signs of bruising, minimal swelling. My recovery, I just couldn't believe how fast I recovered from this. I thought I would have more downtime. I literally missed 1.5 days of work, and that I couldn't believe it. I still can't believe it as I'm saying it.
The reason we put patients on is, we're talking about all this, but we look to you guys, the patients, to tell the audience, yeah, it's really what they're talking about. And is do you have any final advice for people who are on here? We've got hundreds of people on here are like looking, what is this? Am I going to go into the office? Do I want to do this? And you remember how you felt. What is your advice now that you're on the back end of it?
Oh, I just say, don't hesitate, do it. Make an appointment for a consultation and, see what your options are for your particular situation. I feel like now like when I smile, my whole face is smiling. And even my adult daughters have told me that I look good. So that's been a big plus for me too.
And we're looking at your pre-op picture there, and I can't say how many years younger you look, but once again, everyone from all over the country, thank you for coming on, and have a great night. Thank you.
Thank you, Dr. DiBernardo.
Okay, so I guess I'm the last part here, and I'm going to talk a little bit about the other parts we do with the MyEllevate procedure, what goes with it, and we'll talk about that and end it from there. So one of the big problems is, other than the band, something we've been working on for the last over 10 years at our research center, is what can we do about skin? How can we tighten it without surgery? And we've written many papers in the medical journals, first of which we use lasers to tighten the skin without a scalpel, by just tightening with energy. That's when you hear us talking about energy all night, that's what this is. And in the study we did, where we compared just doing liposuction alone with the laser, we got a lot of improvement in skin shrinkage, 54% more than just liposuction alone. This is getting the skin to tighten on its own by just using the laser. And the other big problem when you look under the microscope is the skin loses elasticity, elastin in the skin. And what we showed by doing the laser treatment, waiting 3 months, we had 62% more improvement in the elasticity of these patients. These are from our studies. So when we talk about energy, it's the real thing. It's published in the medical journals, and that's how we're getting away with tightening skin. And this patient here, we tightened her skin with the laser. This is the Precision TX that many of us are talking about. And why am I showing this is because this is just tightening her skin with laser. That's it. How long does it last? Dr. Mueller showed us his patient who's 6 years out. This is my patient. All I did on her was the laser, and this is her 10 years out. So everything we're talking about tonight are long lasting. And when we talk about the combination and the power of the combination, it's all of those things working together.
And Barry, sorry to interrupt. Can you imagine if you put MyEllevate on that patient, what that neck would look like?
This was a really important photo because she just had fat and loose skin 10 years ago, but now she looks perfect, but the bands are coming out. Yep. And that's why MyEllevate exists. We were doing great, but we couldn't treat anyone with bands. So this is the trifecta now in 2022. Thank you. The other thing we can do is we can use microneedling. These are little needles with energy that goes into the skin. And sometimes we'll do this afterwards or in combination and afterwards. Sometimes you have etched in lines in your skin, or you have a little bit of laxity there. We can use the microneedling to amplify the skin tightening. And we also have little molecules. These are called skin savers that we can drive into the tissue, kind of like PRP, but in a bottle. And the Potenza machine can do both. This is what the fusion tip is doing. We put these molecules on the surface. It's being sucked into the handpiece and then driven into your skin. So you're getting the best of the tightening energy and the best of the molecules as you would get in like growth factors from PRP. So we've talked about the necks, but I'd be remiss if we didn't talk about eyes tonight, especially with new technology we have. Because when you look at someone's neck, what's the next thing you look at? You look at their eyes. One of those are going to give away your age. And when, as you just saw in Catherine, when we did both in her, it's a very powerful image of improvement. We can now do with this new advance in the office with local anesthesia. I'm going to show you how we use energy and no scalpels to even do the eyelid procedure. So this is called Tempture. We did a study with 10 patients for this to show how we did by treating eyelids with energy and without scalpels. This is a patient we just did. We look at her hooding of her eyelids, and she's a young lady, and she has skin touching her eyelashes, and you can see afterwards by removing that how that looks way better. These photos are just taken like a week or two later. These are right afterwards, and I'm going to show you afterwards how we do this by using energy for the eyelids. And she couldn't be with us tonight. She's on vacation, but Christina was kind enough to record this on vacation to let us know how she's doing.
Hi, I'm at the beach this week, so I apologize for my hair, the background, and just generally how I look. I am recording this to let you all know about my experience with the eye lift Dr. DiBernardo did for me using MyEllevate. I was very confident in having Dr. DiBernardo do the eye lift as he had done it for my older sister about 6-7 years ago, I think it was, and he did a fantastic job, and she healed beautifully and is still very happy with it. However, when I went to go see Dr. DiBernardo recently, he informed me that there was a new procedure that would minimize recovery and just overall be much easier. The fact that I am a full-time single working mom and I didn't want to take much time off from work in order to do this, it made it much more appealing, the prospect of it being a quicker, easier recovery. But I figured I'd still have a lot of bruising, a lot of swelling. I was completely prepared for all of that. I got it done on a Friday and I went to work on Monday. I took it easy over the weekend and everything, but I and my colleagues and everyone were completely shocked because I didn't have any black and blue. I had a tiny little bit of yellow on the side of each eye that dissipated in no time, and very, very little swelling. I did do ice pack as instructed, everything. And like I said, I did take it very easy Friday through Sunday, but I was actually working on Monday. And I just had it done May 13th, and people, as soon as I got the tape off, people didn't even know that I'd had anything done. And I just couldn't be happier with it. Again, Dr. DiBernardo and his staff are fabulous and wonderful to deal with, but the technique it was astounding how quickly that I recovered from it. Oh, and I didn't mention, I didn't have any pain whatsoever. That was really bizarre. I didn't take one single painkiller after it. I don't even know if I think I took Tylenol. I think I may have taken Tylenol, but didn't use any of the prescription painkillers. I had no need for it whatsoever. So anyway, that is my experience, and I'm very, very, very happy with it. And I ran way over the 2-minute mark because I am just so delighted with the whole thing. So thank you very much.
Wow, that was good. I don't think I have anything else to say after Christina. But what we're talking about is temperature. And I hate to show some patients open wounds like this, but the beauty of it is this energy removes skin. There's no bleeding. There's no swelling. There's no heat from this. And that's why the doctors appreciate this. We've eliminated scalpels, and we use these little tiny tips that have energy in them to get better scars. And as you heard, less swelling. So this is using an electron microscope to magnify 10,000 times. And what you see on the left is a knife is not a clean cut. It takes the collagen fibers and it kind of tears them. And when you try to put that back together, the body has to fill in all the space with scar tissue. On the right, it almost looks like the end of a box of spaghetti, where those are the collagen fibers perfectly cut. And when you put those together, the body doesn't have very much work to do, so you have minimal scar. Even when we look with special cameras that can see under the skin, if there was scar tissue, it would be black. And this basically doesn't show very much scar tissue right where the arrow is on the scar. So look at the patients. These are patients from our study. These are 3 months later, and just look, they're almost imperceptible. And as you heard from Christina, she was back to work after the weekend. She's on vacation a month later, and she just got right back. So I think the temperature, this is called temperature surgical. It's revolutionized what we do, and just get these beautiful, beautiful eyelids that go with the fast healing of the MyEllevate procedure. So to conclude, I'll do the conclusion of the MyEllevate. Now we have the technology and the technique, thank you, Dr. Mueller, that we can treat all aspects of the neck, the loose skin, the muscle bands, and the fat through a little puncture. It takes less than an hour in all of our hands. It's done with local anesthesia. We do it in the office. You've seen a fairly fast recovery, and this is and we're going to have question and answer soon, but you can ask all these top plastic surgeons from around the country. This is one of the biggest advancements we've seen in the last decade, I would say. In Elle magazine, it's not just us, it was top procedure of the year in Elle magazine, and we're just so happy you could all join us.
So next, we're going to go to Q&A. We've had a lot of people messaging the whole time with a lot of consistent questions. There's some that the doctors have done a great job of answering many times over, so I'm not going to ask those again, but there's several that, oh, Dr. Hughes, do you have a question?
Yeah, I have a question for Dr. DiBernardo.
Oh, cut in line, go ahead.
Right, so we're here for MyEllevate. Why are we talking about eyes? Can I answer the question? Because I think in addition to the neck, the upper eyes are the two best procedures that we have at our disposal for natural results, minimal scarring, everything we've talked about tonight. I think the two go hand in hand, particularly now with MyEllevate, right? So the neck bothers people and upper eyes. Everyone needs their upper eyes done at some point in their life, and everyone needs their neck done at some point in their life. And
that's why
both can be done under local anesthesia, right? So that's, I answered my own question, but you know.
That's why I put it in, because so many times we're talking about the neck and we just went right to the eyes, and frankly, with the techniques of what we're doing, I can pretty much say that to do the MyEllevate neck and the eyes in the office, it still takes less than an hour. Right. So, and if you're going to be recovering from the short recovery from your neck, you have the same short recovery for your eyes. And as you just said, the two are the key age indicators, and why not?
And they are the best results and the easiest recovery.
And also, what we're doing is new technology tonight.
And then other things we've done at the same time as MyEllevate: eyelids, upper and lower, laser resurfacing, fat grafting as well we've done. And then sometimes we've added this on to patients who are under general anesthesia for something else. I said that earlier, but occasionally breast surgery, patient wants to add it on. So think of it also if you're coming in for something else.
Yeah.
So Morgan, what are the hot questions?
Obviously, the most common question we're getting right now is, how much does it cost? I just want to say it is basically physician dependent. As we've talked about, it depends on where you are and which part of the country. Also, there's going to be a range due to all the different enhancements that we've talked about adding on. And so that's really why we encourage and we need everyone to come in for an actual in-person consultation, because this is not kind of a one and done, one size fits all. So any of the physicians, if you agree, disagree, but that seems to be across the board. You know, people are wanting to know, but I know that it is such a range.
Yeah, that's why we have the consultation set up, so we can meet with you individually and customize exactly what you need.
And that's why we have the contact information, which you can see, so you can start that conversation with them.
Okay, great. One of the questions that has been asked several times in the chat, many people are wondering what happened to the sutures over time, and would there be anything that happens that would require those to actually be replaced?
That's a great question. I've been researching and developing this for over a decade, and that gives me the wonderful ability to have gone back in. Maybe a patient had a MyEllevate 10 years ago, and then she comes in and she says, I have a little bit of loose skin. So I've been able to do a little skin tuck later on down the road and go in and see the suture that's been in there for 10 years, and nothing happens to it. It's just sitting right where we placed it. That's the beautiful thing. So if somebody comes in and they've had some recurrent aging, we can just put a new MyEllevate right over it. It doesn't cause any problems in the long term, which is great.
And I don't know if we talked about it, but Dr. Mueller based this on a procedure we wrote about in the early 1990s. So that's called the neck suture suspension procedure. And I see patients that have had those sutures in for over 20 years. And this is really the distinction between the thread lifts and those absorbable sutures. They only last about 6 months. We are putting these sutures in to give support on a long-term basis, not 1 year, not 2 year, 5, 10, very long. And that's why these suture procedures exist this way.
Perfect. Dr. DiBernardo, thank you. You just happened to answer the next question I was going to ask. So a lot of people had a question comparing what is the difference between what they're seeing with the PDO threads and with MyEllevate suture. So thank you. I think that was
I think they should just say a little bit more about that, because that's a very, very common question. So Jason, Greg, do you want to say any more about those other type thread lifts?
I would just say briefly that PDO threads or thread lifts, they go in the skin itself and they just lift up the skin envelope. MyEllevate is completely different because it's suture material that surgeons use in all other areas of surgery, but we're using light guidance to deliver it right on the muscle through little punctures. So long-term results, very safe. Jason?
Yeah. I'm not a big fan of thread lifts. I don't think they last. I don't think they work that well. And almost everyone I've ever seen who has one, who's come to the office, said they wish they didn't get it. It was a waste of money. This is not a waste of money. Yeah, this is a suture suspension. It is not a thread lift.
Those are more like your Botox and your fillers.
Yeah.
They're temporary, where this is a real surgical procedure. It's a long-term, one and done type procedure.
So good. Thank you so much. The next question we get from a patient who is a bit younger, getting married, wanting to know, is this something that they can do? Typically, we are being shown other options, especially in today's world with injectables, filler, building out the jawline, even Kybella to contour. Is this something that you can say bypass all of that and go ahead and do a MyEllevate for a younger patient, really just wanting that super defined jawline?
I mean, I think go, Barry, you're up.
I'll go first, you go second. In that patient in the past, obviously it's individual, but I found in the younger patient, the main thing they had was excess fat, and doing a little liposuction took care of it. But now that we have the ability to add the MyEllevate, I give those younger patients a choice. I say, I can remove your fat, that will help you, but now do you want more definition? And we can add that more cut Hollywood jawline and give them that option. And most of them want to go in that direction, but it's all very individual for the younger patient. Duncan?
Yeah, and I was going to say, first, it's individual, obviously, but something that I actually learned from Barry very specifically was just that point where a younger patient whom I wouldn't have thought was a good candidate for MyEllevate is, because it lasts, it has a great duration, very minimal downtime, natural results, right? I mean, you've heard me talk tonight. I keep coming down to no scars and natural results. That's what I'm hearing all day long. And so back to one of my other slides is there really isn't anyone who's not a candidate for some sort of version of this. Obviously, she could benefit from potentially PDO threads, maybe Kybella, maybe filler, but maybe not. Maybe she could bypass all that, as you asked, Morgan, and just get the MyEllevate and get where she wants to go.
What I found recently from my own experience is that a lot of weddings today, it's all about the Instagram, the photos, the Facebooks, and look as good as you can for all that photography.
And with just the energy-based devices and the filler and the Kybella, right, there's the downtime, and the energy-based takes some time. The thing that I'm most impressed about with the Ellevate is how quickly you see the results without that real big window of downtime where you tell someone, oh, you need to get this done 6 months before the wedding. You know, it's changed that timeline for whether it's an event, weddings, something like that.
Yeah.
I'm going to stress that's very important. The things take 6 months to cook, like the energy, but the suture gives the immediacy to the procedure. But I interrupted Jason.
No, I was just saying we all have everyone on this call has a lot of technology in their practices. And when patients come in, we evaluate them and go through different options from different costs and different recovery periods. But we all love this procedure.
Thank you. I think you guys all kind of touched on all the things. I just have a few more that I don't think we've covered yet. Specific to African American skin and really into keloiding, because you all mentioned that this is a sutureless closure for this procedure. Are you seeing any issues on any darker skin types, particularly African American skin, when going in and not having to use a suture to finish the procedure?
With over 10 years of experience using suture suspension and using the light guided technology, I've treated patients with all skin types, and we've had no keloids or skin discoloration issues from the procedure. Each little puncture is slightly smaller than 2 millimeters. So you can imagine it's just like a little needle puncture, and they heal within days.
We might be careful with the MyEllevate Plus in a really true keloid former, but you know, we really have to see.
Jason, the Elevate Plus is actual. You know, you're making decisions, so that's more surgical. But as far as the puncture wounds, Greg, you haven't seen any keloids formers in 10 years.
No keloid formers with the MyEllevate alone, Jason. And you're right, with incisions that does add another level of complexity. So yes, with those you could see, you know, keloids or hyperpigmentation.
Usually keloids are a bit less in the face, but for the MyEllevate procedure, the punctures are not really big open wounds. And I also wanted to address some people here about lasers and darker skin. This is not a laser on the surface. We're working from the inside, so it has nothing to do with any color of the skin with the energy that we're using. Same with the radio frequency.
Perfect. Thank you all so much. Two last questions that have come up really in tandem. Can you feel the suture once it's been placed in the skin?
Greg?
So the suture material, the way it's delivered right on the muscle. So you have the fatty layer and then the skin on top of it. Occasionally, right after the procedure, when patients look downward, they can feel the strand right kind of below the earlobes, because that's sort of the thinnest skin. But I've never had anybody feel it long term. So they do feel some tightness, and we want that. That's a good thing. But as far as feeling the strands, no. Think of the suture as the same size as a thread that you'd sew a button on a shirt. Very small sutures. You don't feel them, and they're very soft.
Soft and small.
Excellent. And really the last one, in kind of context of not having as much downtime, but there has been the mention of having to wear the compression garment. So what does that look like? How long are you wearing it? Is it 24 hours a day? Is it something people can get away with not wearing during the day, but then wearing it at night? So doctor's best outcome, what would that really look like?
I would say doctor's best outcome would be 3 days of a chin strap over the top of the head at all times, except when you're icing. We encourage patients to remove it. Then we have our patients wear a soft collar, like you would if you got rear-ended in a car accident, for 10 days, but only when you're sleeping or if you're going to be looking down. And we do that just to keep the neck in neutral position to help the platysma bands heal better. How about everyone else?
Same.
Agreed. Yeah, same. And to know, when you shower, obviously everything comes off. So showering, everything comes off. I encourage patients, if you're looking at your phone, don't do this. Do this. Keep your neck band on.
And if you have something important to do, take the collar off as long as you're awake and looking forward. And just to stress, the reason he has the collar going on for 10 days is those little bands that we divide. If you don't, they want to grow back together and you would get a recurrence of the bands. But if you can just maintain your neck in the upward position, sleeping and during the day, they're going to heal in place, and then you're fine. So it's just to prevent that recurrence of the band. And it's not that long, really, and you can take it off when you need to.
Last question I will ask, because I know we talked about everything from just MyEllevate under local to all the other additions. When are patients really seeing that optimal end result?
That's a very good question. I would say whether it's a plus or a regular, at 2 weeks, they're looking good to do most things. And by the time they get to 4 weeks, I think it's looking exceptional.
Agreed.
What about
Even
everybody
if you
else?
have the eyes at 2 weeks, I say you're pretty darn functional from going out into public. At 4 weeks, good to go.
And Christina's on vacation now at 4 weeks.
Yeah.
I agree.
Wonderful. Well, that was all the main questions that had come up that you all didn't already cover once, if not twice over in the presentation. All the attendees were getting amazing messages, just thanking you all for your time, your expertise, and for really just doing such a great job of illustrating all the different options and now what MyEllevate can do for, you know, patients that before felt there wasn't an option because they didn't ever consider a full facelift or a lower facelift.
Just so all the viewers, those of you who are still on, I see there are several hundred here still on. These surgeons who are on here today, Dr. DiBernardo and Jason Pozner, have trained dozens and dozens of surgeons on MyEllevate, and they've done hundreds of cases. Duncan has also done many cases, and I've seen his cases, although he's not a training center. So you're really meeting today with the foremost experts in this area, and all of us love technology. And
Dr. Mueller, I formally trained with Dr. DiBernardo and Dr. Posner in their ORs.
You need to come to Beverly Hills. You've got one more stop. No, but anyway, y'all are meeting with really the experts in the field. And Dr. DiBernardo was talking about the temperature surgical. I just used it today on my neck lift. It's like Star Wars. The soft tissue just falls apart. You're not even cutting it, and it's beautiful technology. But all of us are really expert in what we do, and I hope you all enjoyed it, and I hope we hear from you. And thank you, Jason. Thank you, Barry, and thank you, Duncan, and thank you, Morgan, and everyone behind the scenes.
Okay. Good night, everybody.
Good night. Good job, everybody.